We actually treat the sickest of patients that come into the hospital. These patients are coming into the hospital's emergency room, and we're usually getting these patients into the operating room here within minutes. This is ultimately the equipment that we need. So their vessels are acutely closed. We take a small ultrasound, which is placed onto a catheter, and we place that into the artery. The technology here is amazing.
This is a biplane, so it allows us to look at two planes at the same time. This is how we used to work. Previously, we would only have this option. And so now we can bring this lateral plane in simultaneously. And so we can get a lot of different angles really at the same time. They can spin around the patient like this. We can use the frontal plane to sort of change our angle. Sometimes aneurysms are very small. They can easily be missed if you're only looking at them in one single direction. The sharpness of the picture can even pick up things as small as 1 or 2 millimeters.
What I use this room for is patients are coming in with acute heart attacks. We're putting catheters up into the heart, and we're putting wires down arteries of the heart and putting balloons and stents into these arteries within 20 minutes. So we're talking about very short periods of time to gather all the data and to provide emergent intervention on these patients. The better you are in stent placement initially, the better long-term benefits you have for patients. The other additional benefit is that the amount of radiation exposure that both the patient and also the providers and the staff are getting are significantly decreased over time. You can have both the cameras situated where you can give less injections of contrast. The more contrast that is given to patients who have underlying kidney disease, the higher risk of kidney failure.
And so this now allows us to treat these patients much closer to home. It allows us to treat these patients in a safer fashion. The faster we can get these patients on the table, the faster we can get the blood vessels accessed, the safer and the better our outcomes are going to be.
It's all about the patient outcome for us, absolutely, 100%.